So should I start here? I think, Vicky, you were first referred to me by Abd Tarhani, who's a very good friend of mine and a good friend of yours.
Yes.
Tell me, how did this come about?
I think having been that patient for 16 years now, so I had room Y bariatric surgery in August of 2005. So it's coming up to my 16-year anniversary. The work that I do, obviously representing patients across Europe and engaging with people like Abtarani as a specialist in endocrinology and knowing the science behind obesity, I kind of learned that there's a little bit more to weight regain than you've just started eating a little bit more. So through those conversations with Abtarani, I said, maybe I need to actually take the management back, and has he got any suggestions? And he said, I do know this surgeon who is world renowned for revision surgery, and this is perhaps one route you go down. And he went through all of the different elements of it, and I thought, right, maybe I need to start that journey. So I did look everywhere. Obviously I live in Lanzarote, so I live, a few thousand miles south of the UK. But I suppose when you are looking for surgery, for me it was, am I going to get somebody who is renowned at doing revision surgery, somebody who knows this, who has been there, who has the pre, the peri, the post. And when I came to conversations with colleagues, everybody pointed their fingers towards you. So hence I actually came and visited you 18 months ago.
Yes, it's been a journey. I think it was very nice of Ab to bring us together. And I think in the last 18 months, we have discussed all options.
Yes.
We looked at medical options of how we can manage weight just by giving medicines, such as Saxenda. We looked at other options which are just basic dietetic training, and then we looked at surgery. And I think it was important for us to give you and give myself those 18 months so that we can prepare for the day. I think we've tried working everything up psychologically and essentially treat obesity just not surgically but holistically. See what we can change dietetically, and then look at a lot of surgical options and decide which surgical options we think will be the best in your situation.
Yeah, I think that was really important for me because I think having been through the process the first time around, one thing that I discovered was that as that patient going in the first time, a lot of the patients tend to feel that this is the golden ticket, right? You're getting your surgery, you are going to lose the weight, and that's it. Obesity is, never more. And I think I had that mindset going in the first time, and unfortunately I didn't have as much of the pre and post care that I've received now. So having gone through that, I thought to myself, I need an all-round. I need that psychological evaluation. I need the dietitian on side. I need that whole multidisciplinary team. I need all those conversations with yourselves where I probably drove you barmy with questions on, and what about this, and what about taking it this way, and what happens here. But for myself, those 18 months were imperative that I could actually absorb everything that was going on, and I was aware of what stage I was at. So that whole holistic approach has made me realise that this is taken me in a big step forward in managing obesity, which is, people say, oh, it's all about the weight. And it's like, the weight is the number on the scale. It's about being able to walk without being breathless. It's reducing the back pain. It's being able to, get out with my kids and go swimming and do the extra few laps, and it's about all of those gains as well. So I'm delighted we did kind of go down that road, the holistic road. And for me, I think for a lot of people that watch will probably say, revision surgery, what exactly is it? So that's what I want to pick your brain about it as well.
It's good that you asked me about it, Vicky. I think first I would start with the 18 months. I think what patients need to understand is that we do not need to rush into surgery. Obesity is there to stay, and we need to find a permanent and sustained treatment for it. And that's why sometimes we have to take time. We have to make sure that the patient is ready for it, the system is ready for it, and we all understand each other so that we can produce the outcomes.